Hey everyone, welcome back to my YouTube channel. My name is Mashangu. Are you recently diagnosed with diabetes? Let me tell you a story about me, what happened to me. As I said, I'm going to share with you my journey. One day I was coming from Pretoria in South Africa. I boarded a bus in the morning, but few days, I was feeling pain on my, like here on my back or along the spinal cord, the spinal region. That's where I was feeling pain. It was like something, a ball around there, And then I was thinking of the West. I was not thinking like maybe simple thing, because up to now I didn't have the problems that I thought I had. So what happened is that few days I was feeling that pain, like there's a ball along there, and then I had to cushion myself, even if I'm sitting on the chair or in the bus. I had to cushion myself with a pillow. So I said, hey, there's something wrong. I don't even understand. What is it? It took about maybe 1 week. And then after 1 week, as I'm telling you that I boarded a bus, I said, now enough is enough. The following day, I went to the doctor. And then when I reached home, I went to the doctor to see my doctor. And then when I was there, my doctor was called to the hospital. He had a patient. I think it was a laboring patient. So he was called. So he cannot leave us there in the office without anybody to attend to us. So what he did, he arranged for a certain doctor to come and complete the consultations, because he was not going to come back. Anyway, the doctor came. For me, before waiting for the doctor, I went to, because while we were waiting for the doctor, next to the doctor's office, it's my friend's house. So I went to my friend's house. When I was there, she gave me food, and then also she gave me a sweet drink. And then I did drink. It was sweet anyway, but I enjoyed it because it was the time that I was not restricted. I was drinking anything, whether sweet or anything. So, but I enjoyed the drink. I went back to the doctor, and then after that, he saw me. It was my turn, and then he saw me. He took. I told him about my problem, what I have, what is the problem with me. And then he said, okay, let me check your blood sugar. Anyway, there was no problem. He checked my blood sugar and it was 9 millimole per liter. And then he said, no, hey, your blood sugar is high. You have diabetes. I said, no, I don't have diabetes. I don't even have symptoms of diabetes. And then he said, no. I just said, no, I just ate something from my friend. It was very sweet drink. So that is why maybe my blood sugar is high. But he said, anyway, even if it's like that, your blood sugar is high. It was not going to go up like this. Though it was 9.5, something like that. If I remember well. And then I said, okay. And then he examined me, and then he gave me the other medications for the other problem that I came for. And then he also gave me the metformin. So I was surprised anyway why he gave me a metformin. I didn't query, because I know that, I don't have diabetes. He's just, this doctor is just, I don't know what is happening with him, why he's thinking like I've got diabetes. So now, he didn't even take bloods to the lab. But anyway, he gave me metformin. I came home, I took my medicines, and then I also took metformin. But with metformin, I took it only for 1 week. because I didn't have anything, and it was a nasty feeling with that metformin. I didn't, the taste, after taking it, also the feeling, I didn't like it, So anyway, I decided to stop after 1 week. And then after 7 months, I think somewhere after 7 months, I started to have like urinating frequently. I started to become so thirsty. I was drinking a lot of water. And then I wanted, because it was approaching summer, and then my water, like 5 liters, was in the fridge, deep freeze. I had to take that water. And then I'll drink it, drink it like anything. I was so thirsty, drinking it thirsty, going to the toilet always. It was so disturbing. But still, I didn't go to the doctor. I knew that now I have diabetes. One day there was a, what do you call this, campaign in the hospital. And then they went to the malls. So I was there at the mall, and then I went to them to take my blood sugar, because it was a month after I experienced some symptoms. And then, just imagine me sitting for 1 month without even going to the doctor, knowing that now I'm diabetic and I'm not taking anything. And then I'm starting to be miserable. My skin was so dry, and then I was so thirsty. I'm drinking a lot of water, and I was just mixed up. But I was not even worrying to go to the doctor. I was not even thinking. I said, no, man, they are going to tell me that I have diabetes. They are going to diagnose me now officially that I'm diabetic. So I went to, where is this place? Okay, as I said, I was in the mall, and then they checked my blood sugar. My blood sugar was 30 millimole per liter, which is equivalent to which is equivalent to 300 and I think 500 and something, 520 or what, which by milligram per liter, it was too high. So 30 millimole per liter, it was too much. Then now started to knock on my head. They said, no, we are taking you to the hospital. I said, no, I'm not going there. They said, no, you are going to the hospital, my dear. Your blood sugar is extremely high. It's very high. It's critically high. I said, no, I'm not going to the hospital. I know where I'm going. I will go and see my doctor. And then they said, what about tonight? I said, tonight, no problem, because I managed to live so many days without any problem. So tonight won't be a problem. I know now at least my blood sugar is so much. Anyway, I went to the doctor the following day, to my doctor, and then I just tell him, my doctor, now I have diabetes. And then even yesterday, my blood sugar, it was like this at the mall. And then he said, oh my God, it's too high. And then he checked my blood sugar with this thing, the prick, the finger prick. It was a 29 millimole per liter. And mind you, it's fasting. I did not eat. And then it was 29 millimole per liter. Oh, now reality. After that, he prescribed some blood tests for me, prescribed some medicines, metformin, and then I started metformin. Anyway, after 3 days, all the symptoms at least subsided. But I was shocked. I was in denial still, but I was scared of the complications of diabetes, because also doctor reinforced the complications, and then he told me, please take your medicines, don't do the same like what you did before. And then now, if let's say maybe I took my metformin, I'm telling you, I'll be healed from diabetes, because it was only 9 millimole per liter. I was going to work on it. And then also, because, you know, if I knew what I know now, definitely I was not going to be living with diabetes. I was going to work on it and get rid of diabetes. But no, I didn't know anything about it. I didn't know much about diabetes like I know now. Anyway, after that, I was in depression. I called my friend and tell him that, hey, that, you know what, my friend, I've got diabetes. She was feeling sorry for me. And my friend, you know, was somebody who is eating a healthy food, always drinking tea without sugar, and then eating, cooking healthy food always. So for me, I was just eating anything, you know. I never thought that like one day I will be diabetic. But though, you know, my family has got diabetes. My mother was diabetic. But for me, it was not that a problem that much, because, you know, I thought I was not going to have diabetes. And because at that time I was about 50 something years, you know, I said, no, you know, usually we start from 30 something years to have diabetes. And then now I'm past that stage, so I won't have it. And for me also, the tea that I was drinking, I had sweet tongue. You know, my tea has to be with like 3 spoons of sugar. Though I didn't like cakes and all this, but when it comes to a sweet tea, definitely I used to like that one. I drank tea, sweet tea. So, you know, if you know those the cookies, those sweet cookies, so they said they're called sweet sisters in the Africans, I think. They are very sweet, coated with sugar. Oh, I like them very much. I used to like them very much, but now, of course, I cannot take them, even if I'm not diabetic. But I don't like them anymore because they are very, very, very sweet. I don't like them. But anyway, what happened is when I was diagnosed, I started to take my medicines. And then after that, there was one day my sister cooked beetroot. And then I used to enjoy beetroot. But you know what? I was not aware that once you drink beetroot, it comes out as like the color, the red color comes out when you urinate. For me now, I went to the bathroom and then I was urinating blood, like red urine mixed with, you know, that beetroot. It was red for 3 days. I became more depressed. I called my friend. I said, no, you know, I thought I'm only diabetic, but now I am passing urine with blood. And then she said, oh my God, this is very bad. Go and again to be seen by the doctor. I said, I don't know, you know, I'm thinking of what the doctor is going to say about this now, because really, I don't think like I have bilharzia. I don't think, because maybe because I was urinating too much, now there is some erosions inside, you know. That is why I am passing a lot of urine. I'm passing urine with their blood. But now at least the symptoms of passing urine and thirsty, they subsided. I'm okay now. I'm feeling better. Sure. After that, it gradually cleared up the urine. And then now I knew, okay, it's because of the beetroot. I ate beetroot another time again. I just wanted to see that what I experienced before, it was because of the beetroot. Then I ate another beetroot, and then I found that, okay, now I am passing urine, the red color urine, but not like blood, but it was a red color. Gradually it cleared off until it was clear. then I knew that it was because of the beetroot. And then this, I think it helped, I managed to help somebody, because, you know, this lady also was just like me, cautious about her health. And then she went to the bathroom, she ate beetroot, and then she was passing urine with blood, like the red urine, not with real blood. It was like she was thinking like she's passing urine with blood. So I asked her if she ate beetroot. She said yes. I said, oh, already she went to the doctor, and then she was asking me to check her results. I said, no, I'm not allowed to check your results, because you know, I'm not authorized to check your results. But anyway, your doctor will tell you. I said, what is the problem? She said, because I'm passing red urine, you know. I said, okay, did you eat beetroot? That was my first question. And then she said, yes. I said, no, don't worry. It's because of the beetroot. Even those, that urine that you send it to the lab, you'll see the results will come negative. They won't have anything with blood. And then after a few days, she called me. She thanked me very much. And I was happy also, because, you know, I also helped somebody because of my experience. So now, living with them is not a joke, you know. It's not a joke. You know, you go through a lot as long as you are diagnosed as diabetic. Just like me, I was diagnosed as diabetes, to have diabetes mellitus, and then I was in denial. I was, you know, bargaining, you know, thinking, why last time the doctor told me that I am diabetic, he gave me metformin, and then I took it only for 1 week, and then I stopped. Then I started to blame myself, you know. And then again, I started to blame the doctor, why he checked my blood sugar, because I didn't ask him to, I didn't go with the symptoms. I didn't present with the symptoms of diabetes, but he checked my blood sugar. So now, was it worthy? Yes, it was. But for me now, I am blaming the doctor why he did something like that. You know, I don't, you know, sometimes I was just confused, you know. Anyway, then I started to continue with my medication, and then I had my blood test. My HbA1c was high. It was something like 13%, if I'm not mistaken. And then 11 to 13%. So it was very high. So now anyway, because I've started the treatment, he gave me another, I started metformin and something else. I forgot what he gave me. So I was taking 2 types of medicines. And then there was also this one, with my blood test, cholesterol. So I started to take cholesterol medicines. So now I was okay. But the only thing that was remaining with me is the information. You know, it was I was not hooked on the internet. It was not like now when there is you know, like hooked on YouTube, internet for this and then searching this. No, we were not searching a lot. You know, most of the time we find that I don't even have data to search for anything. As long as the doctor told me this and this and this, I followed, you know. But it took me time to gradually wean from the sugar, you know, on my tea. And then gradually, I started not to put sugar on my tea. So sometimes I just decided I'm not going to drink tea for that day. Most of the day, I was no more drinking tea because I was tempted to put some sugar on my tea. So now, from there, what happened now? I continued. There's a lot that I came across, like, you know, small things. I'll tell you on my next video about what happened, and then gradually how I managed my diabetes fully. And then like now really I am I am okay. I like my myself now. And then I don't feel like I'm having diabetes because I'm living a life with like anybody around, you know, who is not diabetic. But I found, like, you know, there are many people around that they don't understand their condition. They are drinking too much beer. They are drinking too much sodas. They are drinking, they're eating a lot of things that are, you know, they are too sugary. So I don't know, you know, for me now, I stopped everything. But I was not eating, I was not drinking alcohol. I was not drinking what is it? Yeah, I was not drinking alcohol. So that is why I cannot say that, you know, I stopped drinking alcohol, because I was not drinking. I didn't like alcohol anyway. So now, bye for now. And then please subscribe to my channel. You'll hear more about diabetes. I think I'm going to talk about the types of diabetes next time. And then so that you understand more, if let's say maybe you never came across these lectures of diabetes. So I'll be talking about them next time. Bye for now. Please consider to subscribe to my channel, and then you share the video so that somebody will learn from me, and then from you share the video. And also do this, hit the notification bell, and then so that it will notify you when I when I upload the video. Please, oh, please subscribe to my channel, and then you'll follow my journey, and then it will help you, and then you will help somebody also. Okay, bye for now.